Appreciate it. What's going on, everybody? Welcome to the Spay City Rottweilers podcast. I am your captain, your host, your main man, Mr. Corey. And today I have a very special guest joining me on the podcast. I have a little bias with our current guest today. She is an amazing person at what she does, and I'm only saying that because have a professional relationship with her. But today we have Dr. Christina Fenton. Good morning, Dr. Fenton.
Good morning. Thank you for having me.
Thank you for coming on. Today is our first time having someone of your expertise on the show, so we're very excited. Have so many questions that we'd love to get your insight on. But if you can just fill the audience in a little bit about yourself, how did you get started in the veterinarian business?
Oh gosh, so when I was about in the 8th grade is when I kind of decided that I wanted to be a vet. A class that I was in at school, we had to go and interview different people in our community that had various jobs, and I went with my dad. We took our dog to the vet and I interviewed the veterinarian there. And he kind of told me about the profession. He told me the good and the bad and said, you know, it's a really great profession if you can handle it. And from then on is kind of when I decided that I wanted to do this. I graduated from Texas A&M in 2007. So I've been a vet for 14 years. Worked up in East Texas in a small town up there. In Cyprus, and then here I'm now in Friendswood.
So in the 8th grade, you already had your mind made up. Was it because you naturally loved animals, or what was it that drew you to being or choosing this profession?
I do love animals. The thing I love about this job, there's a lot of things, but I love the puzzles. So when someone brings a sick pet to me, the dog can't or the cat can't tell me what's wrong. So I have to, use my detective skills, so to speak, to figure it out. And I like the puzzle of that. I also like the relationships that I get with the clients, building those solid relationships of trust and bonding with their pets. And that's a really big part of it for me.
Is there a particular specialty that you do, or are you like a general vet, or are you a surgeon, or how does that work? Is it like the same thing?
Yeah, I'm a general practitioner. I do a little bit of everything. I really enjoy surgery. I pretty much do all the surgeries here at this clinic, but it's because I like it. I really enjoy the surgery side of things.
What's some of the daily challenges that you see as a vet?
Some of the biggest challenges that we tend to have are, I mentioned, a pet might be sick and we have to kind of figure out what's wrong. Sometimes you get some really complicated cases that, nothing's adding up to a logical conclusion. And so things do get a little difficult in those types of situations. The other thing that sometimes makes things hard is sometimes a client will come in and they'll have a very sick pet and they'll want to do everything that they can, but maybe financially they're just not able to. And so then the challenge for us is to come up with a treatment plan that fits in their budget, but that we're still trying to do some good for the pet.
Mm-hmm. Mm-hmm. I'm glad you said budget, because I know in the breeder community, we have a lot of do-it-yourself people because they feel like going to the vet is very expensive, or it can be I don't want to say it, an expense. So they try to do a lot of home remedies and things of that such. What's your opinion on the do-it-yourself people?
I do caution people against Dr. Google. There's an awful lot of information out there on the internet. Some of it's really good information, some of it's not so good. And so sometimes the things that people will do themselves, I don't necessarily have a problem with. Sometimes, though, it can be dangerous. As an example, I had a client the other day that had been giving their dog ibuprofen for a painful situation that happened, and ibuprofen is actually toxic for dogs. So that was a situation where that really wasn't such a good idea. My recommendation for people that want to do things themselves is just, it never hurts a vet's feelings to just call and ask if it's okay first.
Right.
Give them a certain medication, just call and say, hey, is this safe? Can I do this? Because we don't want to get into a situation where we find out after the fact that, oh, that really wasn't such a good idea.
Is it safe to say that maybe you should maybe just start a general relationship with your vet, and then if you want to be a do-it-yourself type person, then you can go ahead, or that way you always have like somebody you can call it expertise?
Yeah, I definitely think it's a good idea to get a good, solid relationship with your veterinarian, somebody that you trust, and that, somebody that at least, like I said, everybody has a different budget. And so, if you're upfront with your vet and say, you know what, we have a very small budget, or the sky's the limit and it doesn't matter what it costs. The veterinarians, for the most part, we're always willing to work within the budget and make recommendations based on what you're comfortable with.
What is an ideal? How often should a person bring their pet into the vet? Let's just say, pretty much everything is clear and healthy with their pet. How often should they frequent to the vet?
Kind of depends on the age. If you're talking about an adult animal, I would say once a year, though twice a year is ideal. The main reason for that is pets age so much faster than humans. Humans, we go to the doctor once a year. That's the recommendation. Humans age about 5 to 7 times faster than that. So, we try to see them twice a year if we can. That's not always achievable, but at least once a year, just to do an exam, make sure nothing's changed. When they start to get older, blood work to screen for things that might affect seniors, things like kidney disease, liver disease, thyroid disease, diabetes, things like that. The young puppies, we usually will see, once a month until they're 3 or 4 months old, just to make sure that things are going well as they're growing, because they're in that stage of growth where they're growing a whole lot in those first few months. And so we want to just make sure that things are going well.
Makes sense. We had an episode here in the past talking about vaccines a little bit. Mm-hmm. How important is it to keep your pet vaccinated, and why should you stay current on vaccinations with your pet?
It's very important. And which vaccine you're talking about varies a little bit in the degree of importance, especially from one region of the country to another. Rabies, of course, is the most important one. That one's going to be required by law for every animal over the age of 12 weeks, at least once a year, depending on where you live. Sometimes it's every 3 years. But that's the biggest one. That's a huge. Rabies is meant to protect not only the pet, but also the humans from getting rabies through their pets. And so that's a big one. Some of the other vaccines, things like distemper parvo vaccines are really, really important, especially when they're young. And puppies, parvo especially, is a very, very serious disease that affects young puppies. Once they get a little bit older, adult dogs are not as susceptible to things like parvo, though distemper can affect dogs of any age. So that's a really important one to keep them protected against. Leptospirosis is another one that, depending on the region, it may or may not be recommended. In Houston, here in this area, we do see leptos, so we do recommend that one. And then things like some of the respiratory vaccines, Bordetella, kennel cough, the canine flu virus vaccine. Those, if your dog is going to a boarding facility or a grooming facility or shows or anywhere that there's going to be dog parks, anywhere there's going to be a lot of dogs in a relatively small space, those vaccines are recommended as well because we don't want those spreading around. Those types of diseases can lead to pneumonias, which can be very debilitating if they get too far advanced.
Taking your dog to the dog park before it's checked out by a veterinarian or before it has its first round of vaccines. How dangerous is that, taking your pet out into the public before it's been vaccinated?
I definitely think it's risky. Kind of like taking your newborn baby out to Walmart before they've had any vaccines that are protected. It's risky. You're exposing that dog to whatever diseases are in that park. So things like the flu and kennel cough, those are going to be transmitted by nose-to-nose contact, respiratory secretions. So at the dog park, dogs are running up, playing with each other, sniffing each other's noses. They might be drinking out of the same water bowl, potentially exposing them to another dog that may have that. Parvo and distemper are shed through feces. So dogs go out there in the yard in the dog park and they poop, and another dog comes running by, stops to sniff it, stops to they step in it, and they can get exposed that way. And so it's risk. You don't know if those other owners are taking as good a care of their dogs as you are. And so you just want to, all you can do is protect yours and do what you can to protect your pet. And so it's risky. It's not that every time you go out there, something bad is going to happen, but it's a risk that you take. And so I do recommend not taking dogs out to places like that until they've been fully vaccinated and are protected.
I know people get very excited once they get their new puppies and they're ready to show them off or take them to the dog park or take them to the pet store and get them their new toys. And that's something that I've learned that people don't really consider or think about before taking their new pet out in the public. And I've heard instances where with the Rowdy breed specifically, parvo is very prominent, and the Rowdies can be very susceptible to the parvo. When I first started doing the breeding, I didn't really know too much about parvo, what parvo was, but it's a booger.
Yes, it is.
What exactly is parvo? Is it something that attacks the immune system, or what is it?
The parvovirus, it basically attacks rapidly dividing cells. So when you're talking about puppies, that's going to include the intestinal tract primarily. It also does eventually attack the immune system, but it depending on there's a few different strains of parvo, depending on which strain you get exposed to, the age of the puppy, the breed of the puppy, whether they've had any vaccines before, kind of determines how sick they get when they get it. It takes from time of exposure until you start to see symptoms, takes anywhere from 3 to 10 days. So a lot of times you get a new puppy and they're acting perfectly normal. And so you take them to the dog park, you take them to the pet store, but they may already be infected and shedding that virus and nobody knows yet. And that's the risk. The other risk is that you take your new puppy and somebody else takes their new puppy to the pet store. One of them's infected. They play together. Now they're both infected, and it causes vomiting, diarrhea. They tend to get really dehydrated, very lethargic. Makes them susceptible to secondary bacterial infections, and they can die. It's a very serious disease. With anytime you have a puppy that's suddenly starts acting tired and not wanting to eat, not wanting to play, is getting diarrhea, definitely you'd want to take them to the vet right away and get them tested for that, because the sooner you get a positive diagnosis on that and start treatment, the better the chances that you can, nurse them through that and have them recover. There's no specific treatment for parvo. There's nothing you can do because it's a virus. Everything that we do is supportive. So we give them anti-nausea meds to control the vomiting. We give them anti-diarrheals to control the diarrhea. We give them fluids to combat dehydration, antibiotics for those secondary bacterial infections, and you kind of nurse them through it until they have to fight it off on their own. With treatment, success rate's about 70%. So there are those about 30% that even with aggressive therapy won't make it. It's a very serious disease.
Can an adult dog fight it off a little better than a puppy, or puppies the only ones that catch it, or they're just more susceptible to it?
Yeah, it does tend to be considered a puppy disease. I have seen parvo in 2 adult dogs in my career. In both of those situations, though, those dogs had never had any vaccines ever. And so they were not protected against that virus. Now, it was a lot milder. They certainly were not as sick as the average puppy. I think one of the dogs was 2 and the other one was, I don't know, 5 or 6 maybe. But they got fairly sick. We still had to hospitalize them. And but they did pull through it. They didn't get nearly as sick as the puppies do, just because their immune systems are mature, and so they're at least their bodies are able to help out a little bit better than the puppies.
Can a dog live a high quality of life without ever getting a vaccination?
I think they can. Again, it all comes down to risk. To not do those vaccines, you're taking a risk that those animals will be potentially exposed to those diseases, and so they're going to be more susceptible. But not to say that they absolutely will succumb to something early in life. I don't think that's a true statement. Though I do recommend vaccines. But there are some dogs out there that for one reason or another, they can't have them. I mean, we have some patients that have autoimmune diseases that vaccines essentially would send their immune system into a nosedive, and it can potentially kill them because of their disease. And so those dogs we don't vaccinate. Now that's a pretty rare situation, but they do occur. And so those pet owners just understand that they have to be a lot more careful with their dogs as to where they go and where they take them, because they could potentially be exposed to something that they're not protected for.
It makes sense. I know they have people who are just totally against vaccinations when it comes to themselves and children, and I'm pretty sure they have folks out there who feel the same way about their pets. Give you a scenario. Let's just say that I am a client of yours, and I come to you and say, "Hey, Dr. Fenton, I'm considering becoming a breeder." What is a general plan that you could give someone who is thinking about considering to be a dog breeder?
So the first thing I would say is definitely do the research on the breed that you're wanting to breed. Obviously, every breed comes with their own challenges. Bulldogs, for example, can't have litters on their own. They have to be a C-section because of their conformation. They have such narrow hips, which is kind of our fault as humans for breeding them that way. But if you want to be a bulldog breeder, you're going to have to plan ahead for scheduled C-sections, which are going to be costly, and you have to be prepared for the potential that if the dog goes into labor before you get a chance to get the C-section done, it could put those pups in stress, and you could lose part of the litter. So you've got to definitely do your research about the breed. You need to know potential complications, of course, during the breeding and developing process. We need to know, potential health problems that may be in that breed, so that you can screen for those things. There's a lot of genetic screening out there nowadays for everything from, hip issues to knees to heart disease, eye issues. And there's a lot of genetic screening that you can do to make sure that you don't breed a problem into your line. You definitely, if you're going to be a breeder and you're going to be a good, high quality breeder, then you've got to do that research, and you're going to have to do that work to make sure that you're producing good pups.
I'm glad you said that. Basically, she's talking about the health testing of your pets. I didn't know about health testing when I first got into this Rottweiler breeding stuff a couple of years back, and I come to now know that health testing is important, just so that first and foremost that your dogs are healthy, and that you're breeding healthy and quality dogs, and if so, a dog can be taken out the program if they carry a certain genetic or certain gene. And I know here in the Rottie community, JLPP is how do I want to say, a very popular thing that people are starting to call other Rottie breeders out on for not testing their dogs for JLPP, and I come to find out that JLPP is fairly new here in the United States. Are you familiar with juvenile laryngeal paralysis polyneuropathy? I butcher that every time.
Polyneuropathy? I'm not, actually. I've never heard of that one.
Yeah, I think it's only been here in the United States about 8 or 9 years, but it's supposed to be very harmful to the Rotties. You're not supposed to breed two carriers. Someone can be a carrier of it, but you can't breed a carrier to a carrier, because more than likely you'll pass that along to the offspring, and more than likely the offspring won't make it. But I'm still doing my own research and paying attention to that, because like I said, in the Rottweiler community, it's a touchy subject. They've been calling people out. Another thing that's a big debate just in the pet owner community: raw diet versus kibble diet. What's your stance on that?
So I'm not a nutritionist. So I will preface this with that. I personally tend to lean towards the kibble diets, just because those diets are going to be formulated to be balanced. So they're going to have, the balance of protein to fat to carbs to vitamins and minerals, and everything that the dog needs in that kibble. I'm not really up on all the current raw diets that are out there. There are probably some really good ones. I know there's probably some shoddy ones. Just like with kibble, you get some good quality kibble, and then you get some really crappy kibble. But the main, I guess, risk I see with the raw diets is kind of the risk that you'll get with, handling raw food on the human side. So potential exposure to things like salmonella and E. coli. Just because of the way that those foods are processed, it's a risk. But I have seen dogs and cats both on raw diets that do extremely well. And I've got clients that will swear by them. And then I've got other clients that say, we tried that and we had, problems XYZ, and we went back to, high quality dog food. And so, there's a lot of debate out there. Nutritionist is probably a better person to ask than I am, honestly. But my main concern with the raw is always the risk for food poisoning, essentially, which is the same risk that we get when we handle raw foods.
Is it safe to say, because kibble is formulated for the dog, that might just be the safer route?
In general, I would say that's true. Like I said, there's good quality kibble out there. There's some that I think are not worth the bag they're in. But But in general, I would say that if you're on a good quality kibble, and it's formulated for, the life stage that your dog is in, whether you're talking puppy, um, adult dog, senior dog, then yes, in general, I think that's a better way to go.
Since the kibble is formulated specifically with all the healthy nutrition, but someone decides that they want to do a raw diet for the dog, are there supplements that you can give your dog just in case that they're not getting all the nutrition that they might receive from a kibble versus the raw?
Yes, there's definitely vitamin mineral supplements out there that you can get to put your pets on if you want to make sure. Now, some of the raw diets that are available commercially, they do that. They formulate it so they make sure it's balanced before they ship it. If you're talking about doing it yourself, you go to the store and you buy raw chicken, and you buy vegetables and what have you, rice to make the meal. I do caution against that because the average person out there is not a veterinary nutritionist, and so they're not going to know what the ratios of those different ingredients are going to be. There are websites out there that are run by veterinary nutritionists that will help you formulate a home diet, and they'll include recipes. So they'll tell you, you take 2 pounds of chicken, and you take this much rice, and you take this much of a multivitamin, and you take this, and you mix it all together, and you feed X amount per 20 pounds of body weight. And they will do that for you. They'll do all of the calculations, and they'll just give you a recipe and lay it out very simply. So there are definitely those websites out there that are run by veterinarians that know what they're talking about. And for those people that do want to do raw diets or home cooked diets, they want to prepare themselves, that's typically where I refer is to those websites. There's a couple different ones that we recommend and we send our clients to when they have those needs.
Is it safe or okay to give your dog table food at any time?
Moderation in all things. That's I definitely my own dogs, yes, they got leftovers. We have kids at home, and whenever the kids didn't finish what was on their plate, most of the time it went into the dog's bowl. So a little bit here and there, it really doesn't bother me. I do get concerned if dog eats an entire turkey carcass or something after Thanksgiving, or gets into a whole rack of ribs. Maybe some problems there. But moderation in all things. In general, I don't have a problem with it. But you do have to be careful because there are some foods that are toxic for dogs. And so that's another place where, checking with your veterinarian before you offer it is a good idea, just to make sure that you're not potentially giving them something dangerous.
What's your breed of choice?
That's such a hard question. Personality wise, I'm kind of partial to a little dog called a Havanese. Looks a bit like a Shih Tzu. They're very personable little dogs. Personally, I've always had mutts. I went down to the animal shelter and adopted. And one I had was a border collie mix. I had her for about 15 years. The most recent one I had was a Jack Russell mix. She was very energetic, and I had her for about 5 years. So I tend to go for the just kind of mixed breeds, but there's a lot of good ones out there. There's a lot of really good dogs, and different breeds. They all have their medical issues that tend to run in the breed, but there's a lot of really good ones.
Is it hard keeping up with your own pets, being that you deal with so many clients on a daily basis?
To some extent, yes. I mean, our most recent dog, she definitely got ignored a lot. But part of that comes from dealing with being at work, 40 hours a week, and then having 3 kids just sucks the time. So the dog, she got kind of, ignored quite a bit, but dogs are great and that they forgive you for that. And so we always made sure to give her lots of love and attention whenever we were, watching TV at night or we're outside playing in the backyard. She'd chase the ball all day if you let her, until she made her feet bleed. So she's a funny girl. But to some extent, yes, I think she probably got a little bit neglected, because I come up here and get to pet puppies and snuggle with kittens all day, and then go home and she jumps up for attention, and I just kind of brush her off because I'm tired of being pawed on all day by that time.
Do you take your dogs to a vet, or do you take care of your dogs?
I would bring them here, and do most of the work myself. Now, a couple of years ago, I was working in a different kind of line of veterinary profession, and I was a mobile hospice vet. So I didn't do just kind of the routine vaccines and surgeries like I do now. I actually went from house to house, and I would perform hospice care and euthanasias in people's homes. And so I didn't have access to, surgical suites and veterinary, vaccines and things. And so when my dog was young and she needed all those things, yes, I took her to a vet, just like any normal person would, and got her vaccinated, had her spayed, and did all of those things, just because I didn't have access to do it myself.
What is your most strangest client that you have had in your profession?
I've had some interesting people over the years. I had, this was years and years ago, even before I was a vet, I was a technician at the time. We had a lady that she was interesting. She was convinced that her cat, that somebody would sneak into her house and kidnap her cat and replace it with a cat that looked identical, and would take her cat away and would keep it for a few weeks, and then one morning she'd wake up and her cat wouldn't have returned, and this mystery replacement cat would be gone. And the way that she knew that it wasn't her cat was because the cat's behavior would change. Happened every few months. The vet that I was working for was pretty sure it was because the cat was going in heat, and mom just didn't understand that her behavior was changing every time she went into heat, and that he could not change her mind. She was convinced that this replacement cat was coming every few months to her house, so she was interesting.
Maybe I should have worded the question a little bit more better. I didn't want to get you in trouble talking about the actual parent, or when I meant client, I meant like the strangest animal that you have to take care of or get well.
Like the strangest case I've had?
Yeah, like the actual patient. What's the most outrageous type of patient, or do you typically normally just see your typical house pets?
We see mostly dogs and cats here. When I worked up in East Texas, I used to see a little bit of everything. So I saw horses and cows and goats and pigs and llamas, naked mole rats. There was we had a fox come in one time. We had something called a fox. Yeah, somebody brought a fox in. Somebody brought in an animal called a coatimundi, which looks a little bit like a red raccoon. They look like. But we had somebody bring in one of those ones. I never was one to really deal with snakes or birds. I tell people I pretty much only want to deal with things that have fur.
Come on, Doc, you can't be scared of the snakes now.
I'm not a fan of snakes. Honestly, I don't even like, I tell my staff all the time, animals that should have fur but don't. So the naked mole rat was a big step for me, just to hold it and not because but that family that brought that mole rat in, they loved it. It was their pet. The little boy, he loved that little thing, and he had an ear infection, that rat did, so we had to treat his ear infection. But you know, they loved him very much, and so even though it grossed me out, I had to pretend like and do my best to help him out.
Deep breath. Was the fox, was that fox domesticated, or somebody just found a fox?
No, it was wild. Somebody had it had, I think, been hit by a car. Somebody found it on the side of the road and brought him in to get some, you know, help, because I think he was on the side of the road. He was or she, I think it was a female. She'd been hit, but and unfortunately we had to euthanize. It was too much damage. But yeah, up there we used to see a lot more variation than down here. Down here, it's dogs and cats is pretty much what I see.
Yeah.
Up there we saw a lot more.
No occasional deer every now and then.
Actually, we did go and do a couple of deer up there. People had, you know, deer for that you do probably see that more in West Texas, where they have the you know, the ranches where people go and hunt, but there's definitely people out there that take really good care of their deer. We saw a couple up there, but not very many.
Lastly, before I let you go, can you talk a little bit about spayed and neutering your animals? Is it right to do it? Because you have some people that feel like it's wrong. If you choose to do it, what is the right age to do it? When is it too early or too late, or just the right time to spay and neuter your dog? And why should you spay and neuter your animal?
That's a really good question. So I used to recommend, you know, spay and neuter every dog or cat about 6 to 7 months old. I've actually adjusted that recommendation a bit in recent years due to some new research that's come out. So my current recommendation is if you're going to spay or neuter, you should wait until your dog is what we term skeletally mature, which basically means when they are done growing, which varies depending on the breed you're talking about. So Rottweilers, for example, are not going to be done growing until 15 months, 18 months, somewhere around there. And you know, little Chihuahua, they're probably going to stop growing at about 7 or 8 months. They're not going to get much bigger after that. So there's a variation, but the reason for that recommendation is in this new research, they have found that waiting just a little bit until they're done growing decreases the risk for a lot of different diseases, everything from certain behavioral problems to certain types of cancer to actually, you know, busted ACLs in the knee, hip problems, incontinence. There's all kinds of things. There's a long list of things that it's beneficial to wait just a little bit if you have that luxury. The risk, I guess, for not spaying and neutering, if you decide not to, if you decide to keep them intact for whatever reason, I do recommend to go ahead and spay or neuter by the age of 7, just because after the age of 7, intact animals, you're going to increase risk for, in males, things like prostatitis, prostatic hypertrophy, testicular and prostatic cancers in the dog. In the females, if you know, once they're older and they're intact, you increase risk for things like mammary cancers. and something called Neuter, which is essentially an infection of the uterus. The uterus basically fills up with pus. It's life-threatening. It's a very big deal. We just had a little dog in here last week with Neuter, and it had probably been going on for several months. And so that's a really big one. And so my current recommendation for spay and neuter is somewhere around done growing. So that small dogs maybe 6 to 8 months. Bigger dogs, it may be anywhere from 1 to 2 years, depending on the breed you're talking about, and then before the age of 7, just because of those risks in those older dogs.
Thank you for that, Doc. I definitely appreciate your time this morning for coming on. I appreciate all your insight. I hope the listeners gain some knowledge from this episode and from you. If they have any questions or want to reach out to you about anything, how can they get in contact with you?
You can call us. Our clinic is Egret Bay Veterinary Hospital in League City, Texas, and we've got some excellent staff with some really great knowledge. And then I'm here with 3 other doctors, so there's always people available to answer questions.
Thank you so much, Doc, for coming on. I appreciate your time this morning.
Thank you so much. Really appreciate you having me.
Yes, ma'am. See you soon.